Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You are watching Conversations with Jennylyn, and as I continue my COVID-19 World Interview Series, I do my best to reach someone in every single country possible to bring you their experiences, their story, and what it's like for them and their loved ones in their immediate environment and country. And this morning, I have my first ever Iranian guest that's ever been on my show, Dr. Sadi. Dr. Sadi, I hope I am pronouncing your name correctly.
Okay.
Welcome to Conversations with Jennylyn.
Thank you very much for having me there.
Sure, I'm so grateful that you're taking the time to spend with me. I was speaking with a doctor in your country who's currently treating COVID-19 or coronavirus patients, but most of my questions, because she is in Iran, she's not allowed to answer. So this morning, if I ask you any question that you do inappropriate, that can potentially get you in hot water, please feel free to skip it.
Okay, I appreciate it. Thank you very much.
Yes, so you are a resident of Iran or a resident of the United States?
I am a legal permanent resident in the United States, but because of my career was in Iran, I mostly spend my time in Iran, in my office for my patients and like that. But my family are living here in the United States. My wife and my son are living here in the United States. And because of my job and my patients in office and etc., I have to go through and back in between United States and Iran. But most of time I'm spending my time in Iran.
So you're actually a practicing physician in Iran,
yes,
visiting your wife and son in the US.
Yes, there is.
So are you here now because you're stuck, or are you here now because this is the time you had intended to spend here when you came?
Mostly, in this time of year in Iran is a New Year holiday.
Okay.
It started from 20 of March, and it takes about 2 weeks New Year holiday. And because I wanted to be with my family in these holiday days, these New Year holiday days in Iran, I traveled to United States on my plan. It was my plan to travel to United States in these times, and I'm not stuck yet. I am just on my plan.
Oh, great.
Yes,
and I only ask because I'm sure right now they would be happy if you were in Iran, because based on the reports, sounds like they have a lot of contaminated people who now are currently suffering from the coronavirus.
Yes, of course.
So are you sorry that you're not there helping? Or are you glad?
Of course I am. Of course, I am a specialist. I'm a neurological surgeon. And in my domain of work, it's not so related to coronavirus, but of course I am a medical doctor, so of course I can help at least in knowledging the people in getting rid of the bad things that they have about it, the non-correct things that they have about it. And I started to doing this online with my patients, my relatives, and every other people that have any question. They can connect me by the online properties like WhatsApp, Telegram, and anything that we can use. Zoom recently, that we are working with Zoom recently, and speaking with people, making guide to them how you must do. Don't afraid of something, afraid of other thing. There is a lot of correct and incorrect things that are in the social media. Social media is full of something correct and something incorrect. And it's our job, it's our duty to enlighten people about what they must do, what they must worry about, and what they must not worry about.
Wow.
So it is the thing that I can do here, and if I back to Iran, I will do it certainly in Iran for people, for patients, or anybody. But I'm starting here by online services and starting here to ensure people, to let them know, to make them feel safe,
Right.
correctly, not incorrectly, or not in a false rate,
Yes.
So it's the best that I can do from here now.
Well, I'm so grateful that you are doing your best from here. That's all you can do, because there's no way for you to return to Iran now.
Yeah, of course.
Their airports are closed as are ours, right? Are
Yeah,
they closed international flights?
yeah, it's the only one airline one major airline that are flying, that continue flying to Iran. The other major airlines stop their flights around the world, mostly, especially to Middle East and the Far East. But there is only one major airline, Qatar Airlines, that continues its flights, very, very limited, to Iran, and it's very, very crowded. And of course, I have some problem to returning back in my plan, of course, And if I want to return, I must schedule somehow to get a ticket, find a place there. By the time, of course, because my schedule will finish about 3 weeks later from now.
So I was going to ask you, but you mentioned it before I did, what your specialty was and where you work. So you are a neuro surgeon?
I'm a neurologist, a neurological surgeon, a brain surgeon, and a spine surgeon.
Wow.
Yeah.
And are you a private practice doctor, or do you work in the government system?
No, I'm a private practice doctor.
Okay, okay. And where do you live in Iran?
I live in Isfahan. It's the third biggest city of country, in about 300 miles south of capital, Tehran. It's the third most biggest city of the country. I lived, I studied, and I practiced there.
Oh, okay. And when you left Iran to come to visit your family,
Yeah.
had the coronavirus outbreak started as yet?
Yeah, it was just at the start. It was just at the beginning of the coronavirus that it was started in the central part of the country, in a city called Qom. It's about 80 miles southern of capital. And it was just started there, and it was just started to spread out through the country, to the capital, to my city. And a few cases were spotted in the capital and in northern provinces and in my province in Isfahan. It was just at the beginning, and people was getting ready, people was getting to know it. The medias, the newspapers, everybody is starting to propaganda about this, to telling people about this. It was I think it was at the first 2 or 3 weeks that I was there. But from the time that I came to the United States, I kept my relation with my friends, my colleagues, with different hospitals, with different people that know, and I kept myself updated about the situation in Iran. I try to keep me updated about the situation, about anything, the people, the jobs, and everything. I kept myself updated from there.
Did you ever for 1 second fathom that it would become what it has become and what it is, and that it would impact your country in the way that it is and has?
It's a very complicated issue. It's a disease. It's a contagious disease. Nobody can do it, and nobody can say, okay, it's not ours, it's for the other countries. It's a contagious, it's a worldwide problem. Nobody can be spared of this.
Right.
It all depends on very it's a multitask, multifactorial problem. It's depend on the economical situation of a country. It depends on the health situation of a country. It depends on the education level of the people of a country. It depends on the social medias and other medias, that how they work in a country. It's a very multifactorial issue. It's not only a disease. It's not only a virus. Of course, it's a virus, but it's not only the virus that do everything. The virus get spread around. It's okay, but the other things, the preventing, to enlighten people, to treat the patients, it depends on the basic uh, elements that works in every country. And as you know, in different countries from east to west of the world, they have different politics, different strategies to confront with this problem. And in some countries, it works better. In some, it works, somehow. And in some countries, in Europe, you see that the Germany do a very fabulous, very fabulous work. In Italy, just near the Germany, they have a lot of problem.
Mhm.
In Spain, they have a lot of problem. In Scandinavian countries, in Norway, that I know a lot of people there in Norway because I have a job career in Norway and Sweden. In Norway, they do great, but in Sweden, they do just the opposite. Of course, the level of their healthcare level are very upgraded, but these different thinkings, different basic things that they use, and nobody can say which one is better, which one is worse, which one is correct, which one is incorrect. Every place, every country, even every state uses their own strategy, their own abilities, their own wealth and health to defend upon this problem. But the worldwide, it's what it is. We see. But we must use our sources. We must use our knowledge. We must improve our knowledge. Especially, we must improve our knowledge. We must learn from our mistakes.
Absolutely. So this is a strange question. Probably you may interpret it as such, and you can choose not to answer it. But if you were the leader of your country, what would you do differently? And it's not knocking what the government is doing, but as a treating physician and someone who deals with diseases and just help people who are ill, this is your profession, what would you do differently?
It's very difficult to put myself in place of some leaders in the country.
No, that's why I asked, but I wanted to see.
I may not be agree with them politically, with many things of some governors or some others do. But when you look at the whole, you look at the economical situation of the country. My country is under a very hard sanctions. The sanctions affects on every aspect of the country, economically, health aspects, medicines, everything. The country is dependent on the oil production and selling oil. Because of the sanction, they cannot sell their oils. The oil prices are dropped down in the history. It's $18-20 a barrel now. But it's
Wow.
yeah, this price is not be the price for the oil a barrel from 30 years ago. So a country is dependent on the selling oil
Mhm.
and not sell the oil. If it sell the oils, it cannot reach to the money that they can send. The oil price is dropped down extremely. The extreme. It's in 30 years. It's the cheapest price in 30 years.
Wow, so it must be definitely
So
affecting
it's a
your
very
economy.
hard situation in the
Yeah.
country economically. So, the other hand, the country Iran is a very big country with a lot of resources. People are highly educated in Iran, highly educated in Iran. You know, the percentage of illiteracy in Iran is only 2%. 98% obliterated.
Wow.
You know, uh, in cities, especially in big cities, most people are college, at least college uh, graduate. They are at least colleges. So the level of education is high in Iran. The level of health is high in Iran, very high in Iran, higher than very places that I know. But the economical situation is not good. So the government have to balance these things together. The
Yes,
government cannot keep 14 million of workers in the house for 3 months without paying. They're living on their paychecks. So the governments have to balance somehow between the health and between the economy,
that's right.
you know.
Right. I
So
agree.
they decided from now that the data and the plateau of the curve, the famous, you know about the curve that is about the corona disease. I
Yeah,
just looking at the curve. The curve in Iran is getting flatter.
that was going to be my next question. Do you see it plateauing right now?
Yes, it's reached to the plateau, and in a few days, in the last few days, about 2 or 3 days, I can show you the data from John Hopkins Hospital that I searched before starting with you. Uh, it's it's a little declined.
Okay.
So the government is thinking about opening some part of the economy. They started to, of course, when they start to opening the parts of economy,
Yeah.
the the data of the sick people and coronavirus will make a little high again, but they depend on their resources. Fortunately, our health resource, our hospitals, our ICU beds, our uh, internal producing medicines are enough for the country. It's covered 90% of the needs.
Okay. That's
So
great.
yeah, it's very great. It's the best news. It's the good news.
Right.
Of course, the sanctions make a very bad situation uh, in export in purchasing of some medication or some uh, personal protecting equipments that is needed in the country from the outsourced country, from the out countries because of the sanctions and bank problems and money transferring problems. That the sources in Iran, the factories, the anything that they can work and they can handle it somehow, and it's the best part, I think. But if about your question, if I were from my experience now, I started to alarming people 2, 3 weeks sooner.
You did? And why? What made you this? What was it that you found out that made
It's
you weren't start the warning? Because a
Mhm.
lot of the countries and people I'm speaking to were saying, oh, I saw this coming. I saw this coming. But I think, I don't know about Iran, but I think a lot of people felt that they weren't going to be as affected by this, because I think the one mistake most leaders that have made the mistake was underestimating the power of this virus.
Yeah, that's correct. You know, from 1918, the Spanish flu, from that time, you have not ever such a pandemic in the world. We have SARS, we have MERS, we had Ebola. That
Yes.
was not pandemic as this coronavirus just now. So nobody expected this pandemic. None of world leaders believe it. None of world leaders expect it. Of course, it is their fault. I accept, I know that it's their fault worldwide in most of the countries. But we must learn from our mistakes.
Right.
When I say if I were, it's because I am here now. Because I saw the problem, I saw the consequences for 2 months. This experience must be used for the next time. The coronavirus, we will live with us. It will never leave us free until we find a very delayed and effective treatment or vaccine. From now to that time, it will live with us. If this time led us to the next fall or next winter, we will have problem with coronavirus again.
Right, because every winter time we have problems with viruses.
Yeah.
So I would imagine this is just going to mutate in another strength and then probably come at us again. But sitting on the outside looking in, because that's what you're doing now, since you're not in Iran and you are actually in the United States, what are you observing looking at your country from a distance that when you return, you can implement for the better of the people you are going to take care of?
You know, in my opinion, everything will change after Corona.
Yes, I think so. I think everyone is learning something from this experience.
Will change.
I know.
Yeah. It's not, we cannot think that we will return to our past lives.
Yes.
We could not and we should not
Right. Exactly.
return to past lives. No, we must learn. We must change our behaviors. We must change our behaviors between each other. We must change our behaviors with the nature. We must change our relationships with each other in and out of country. Everything should and must change after Corona. It will change. You look to this social distancing that we have just now everywhere. It will make new habits in people. Some things will be gone, and we must gone from our social behaviors, like shaking hands. Very simple. The shaking hands must be dismissed, I think.
You think people should stop shaking hands?
Yeah, people must stop shaking hands. People must stop hugging each other. You know?
I'm gonna have a problem. I'm a hugger.
Oh yeah, I know. But it will be a habit. This corona disease are making habits, and I think when I return to my country, when I start practicing again, this coronavirus will be part of my practice.
Yeah, so what are you going to change and what are you going to do different from what you were doing before to help prevent and to protect people?
The first thing that we do, in Iran, the way we practice in our offices is somehow different with the way it's in the United States. Our offices are very crowded and full of patients.
Oh,
Yeah. So now, because the kind of practice, the hours of practice are so limited in Iran, and it's a lot of patient there. So the first thing that I have to do in my work is to manage my office, that make it less crowded, to separate people, and in a long time of practice, in the outpatient practice, in the COVID-19 uh, diagnostic test plus antigen test or immune test must be a routine test for us, for the patient that need any elective surgery.
yes.
These are the little things that I'm thinking to, and the protocols are getting out just now. Just now, I'm reading on the some sites about physicians and medical councils of Iran. The guidelines, the protocols are coming out, that how must we do from now on. Everything is changing. Uh, it's the way that I think so, but we must see, and we must wait until see if there is any effective treatment or any effective immunization will be found, and I think it will be, and I hope it will be.
So is your practice a walk-in? Because most doctors here actually have scheduled patients to avoid crowding. If that's not something you did in the past, it might be a good thing for you and only allow your emergencies to be walk-ins.
Yeah,
Think.
it's both. It's scheduled and working both. Mostly it's scheduled, but our schedulation, because of the crowding of the patients, our schedulation is very impact.
Uh-huh.
So we need to schedule our patients in a longer time.
Okay.
We don't want to have a very long waiting list time. You know, the kind of people, the people that coming to me or other doctors, they have severe problems, they have a lot of pain, they are suffering. We cannot expect them to wait a long time for 3 to 6 months to come to me. It's meaningless. They are suffering, they have pains, they have problems. So
Right.
we want to visit them at the shortest time that it is possible and it is safe.
Okay. I understand. Can you believe we're almost out of time? I asked you, what you would change when you go back to Iran. What do you want to leave with my American viewers or viewers around the world that watch these segments that I'm doing? What do you want to say to them?
To the American people.
To people, wherever, whomever is watching this.
You know,
what do you want to say to them?
I think the most, I mentioned it, we must change our behavior. We have to change our behavior. Behavior with each other, behavior with nature. We are not the owner of the nature and the planet. We are a part of nature and planet. We must be more gentle and more polite to the nature. What we have seen here, it's a reaction of our effects on the nature.
Mm-hmm.
We must think again. We must reprogram ourselves. We must reprogram our behaviors in in society, in nature, in climate, everything. And I am sure a treatment for coronavirus will be fine. I'm sure a vaccination will be fine. But it's not, this treatment, this medication, this immunization must not let us forget about these times. Another corona will come very easily. You see, it's only 3 months. What happened in the world? The last data that I have here, it's 1,800,000 people confirmed of the disease worldwide. It's only the people that confirmed. It's not the people that are infected. Be sure the infected people are much, much, much more than this data. Around the world, we have 117,000 deaths.
Can you believe it?
Yes, around the world. These are people, these are humans, these are fathers, mothers, sons, daughters of somebody. These are not numbers.
Exactly. And the sad and the most grievous part of
Yes.
this is that people aren't getting to say goodbye to their loved ones. Could you imagine being in a hospital knowing you're dying and you cannot say goodbye to the people you love? I mean, that is just heart-wrenching.
Yeah.
What do you think of coming up with some robots that can take care of patients in contaminated cases and situations like this so that we can put them on the forefront? Because robots can't get the virus and they can't die. What do you think of that? That idea popped into my head. I was wondering what a doctor would think of that idea.
Never a robot can do the thing that a doctor or a nurse can do. You know, the robot can manage a robot. A robot cannot manage a human.
Mm-hmm.
When a human getting sick, when a human getting coronavirus, of everything, the physical aspect of the disease in one aspect, the spiritual aspect is the other aspect.
Yes, exactly.
A robot cannot do any spiritual treatment.
That's correct. I agree with that.
Yeah.
But maybe there's some parts that they might be able to play with. Artificial intelligence, don't be surprised. I've said there are things that would never happen in my lifetime that I've seen happen. So I'm keeping an open mind, but I know that I know robots can never replace the touch of a doctor, the care of a doctor. I get that. But I think in order to protect staff in some areas, because we've lost so many medical personnel to this, you know, if there's a way, I think apart from all the focus and energy that's going into a vaccine, we should try to put some of that energy into finding robots that can protect you from some procedures.
It's better to use the data to develop you know, artificial intelligence that can help us in diagnosis, in preventing, in something like prevention and diagnosis, that it can suggest us, of course, in treatment. But the final decision, the final act must be done by human beings.
Right.
I cannot believe that a robot or an intelligence, an artificial intelligence can treat people. Yes, it can say, okay, this medication is okay for this kind of disease, but in practice of medicine, you know, the practice of medicine is an art. It's not only a practice, it's the art of medicine. It's like any other arts. It's a spiritual part in it that help the practitioners, nurses, medics, doctors, no different, that decide about others' health, decide how to help other people individually, person by person. It's not a fixed formula. You can never use a fixed formula to treat everybody. You see about the hydroxychloroquine. What happened about the hydroxychloroquine in just three months? In 3 months, at first, it was a miraculous medication. Now CDC stopped using it. What happened?
Yes. Yes. We need to do another segment before you leave. You are a wealth of information and knowledge, and I'd love to, if it's possible, do another session with you before you leave.
Of course. I'm every time that you want.
Thank you. I've really enjoyed it.
I appreciate you having me in your show. Thank you very much.
Thank you very much for taking the time, and you're very, very you're full of great information that I enjoyed learning and sharing with my viewers. And I thank you for taking the time to spend with me and my viewers. And I ask that while you remain in the United States, that you stay safe. When are you going back?
Okay, thank you. Thank you.
Returning to Iran?
Sorry?
When do you return to Iran?
I planned about 3 or 4 weeks from now.
Okay, great. So we'll schedule another interview, and I'll be in touch with you. Thank you so much.
Thank you very much.
And I thank you all for watching Conversations with Jennylyn. I hope you enjoyed my guest as much as I have. And continue to watch Conversations with Jennylyn, when a conversation is all you need to be inspired. And I will see you next time. Thank you.
Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.